So let's call the meeting to order, at least. It's 5:32 p.m. on Monday, September 28th already, which is incredible to me.
I know.
So I am calling this evening's meeting of the Ayer Board of Health to order. Oh, that was a little dingy thing.
Oh.
Hey, is that you, Bridget?
It's me. I'm sorry.
Oh, that's okay. That's
Technical
all right.
difficulties.
That seems to be par for the course for tonight. So we also had kind of a miscommunication with Laurie and Laurel. So they are also on the line and able to present. So I did have an action item or an agenda item for a discussion of Board of Health involvement with PACE and Silent Spring. So we could have them do their presentation under that. My question for you, Bridget, is do you want to go first? Because I know you had a time restriction. So do you want me to move Nishoba up to the beginning?
It's totally up to you. I just didn't know if anyone had questions regarding COVID, so that was my big thing. And then scheduling that public hearing was the next thing.
Oh, okay. All right, I gotcha. So, all right, if it's okay with you, then if we can, let's switch over to Laurie and Laurel, and just understand that I'll have you on the agenda again for the next meeting, so we could do a piece of this evening and finish the rest, because our next meeting is coming up in 1 week. So
yeah, that's great.
Does that work for you?
Yes.
Okay. All right, great. So if we can keep tonight to maybe 10-15 minutes, and then I could give you a maybe 20 full minutes at the next one if you'd like. We could do that.
Laurel has prepared some things, so I think we can make that work. It'll kind of be how many questions you guys have.
Okay. All right. Good.
Shall I start?
Go right ahead.
Great. Okay. And I'm Lori Neary. I am the president of People of Ayer Concerned About the Environment, or PACE. We do have a Facebook page. We need to keep it more updated than we are, but hopefully we're moving in that direction. PACE has been working for a long time with Devon's issues to make sure that it's being remediated environmentally correctly. And we've been working with a grant support under EPA for a little over 20 years, so a really long time. Mm-hmm. PFAS has become an important issue in the last 4 or so years. PFAS in our case is coming at least in part from Fort Devens, and we linked up with Laura Shader from Silent Spring Institute just about 1.5 years ago to help us understand more what's going on with PFAS and why it's important. So Laurel is home, and I see she's probably working with her children in the background who need some attention, but she has prepared some slides that she's modified for tonight's presentation. And so we thought we would divide this into 2 parts to kind of help people understand a little bit more about PFAS, the chemistry, and where we get exposed to it. And then next time we'll talk more specifically about the regulations that are brand new as of and we're really about that. And the research project that Laurel is working with our town on, as well as the town of Hyannis. So
okay,
I think it's going to pull up some slides if she's able to, and I'm going to turn this over to Laurel.
Yeah, can you see my slides?
I can. Can everybody else?
Yeah, I see the first one. Okay, great. Well, thanks. It's nice to be back. Thanks for having me back. So yeah, thanks for that introduction, Lori. So we, at the last meeting 2 weeks ago, talked about doing some more regular updates. So Lori kind of reined me in. I put in a lot of slides, and she reminded me this was supposed to be short. So going to just focus tonight, giving a kind of an intro 101 on what are PFAS and kind of a quick overview on what we know about health effects.
Okay.
And then we thought maybe for the next time we're here, we could talk more about drinking water in particular and more specifics about the health study that Lori mentioned.
Sure.
So I'll talk through these, but if you have any questions as I go, please feel free to interrupt me.
Okay.
So I usually start off with in the news slide, and there's always something new to talk about. So this was just from last Thursday. The Massachusetts Department of Environmental Protection finalized the Massachusetts PFAS drinking water standard. And we'll talk more about drinking water the next time around, but I did want to point this out just because it's pretty big news. A lot of states are feeling like the EPA is moving too slowly, and there are no federal drinking water standards under the Safe Drinking Water Act. So Massachusetts had, there's kind of been an evolution from a guideline a couple of years ago to a draft standard earlier this year, and now they've finalized the standard of 20 parts per trillion for the total amount of 6 PFAS. And so this new standard is among the strictest of any state in the US. And in addition to limiting the amount of PFAS in water, this also means that public water supplies will have to do testing and do treatment. Of course, Ayer has been testing for a while, and Mark Wetzel and his team at DPW has done a great job in really tackling this head on and getting ahead of the standard and putting in treatment to lower the levels of PFAS and make sure the town was ready for this new standard when it was finalized.
Okay.
So I tend to think a lot about drinking water, and that is kind of the theme for the ATSDR health study, but Silent Spring more broadly looks at all different kinds of ways that we can be exposed to chemicals of concern. So here are 2 other studies that we led. So PFAS can also come our way through our diet, from food and from food packaging, and also from consumer products as well. This was on the left here, a study last year where we found people who had stain-resistant coatings on furniture likely to have PFAS in their bodies, as well as oral B glide dental floss.
Who knew?
Yeah. Oh, boy.
So PFAS are common in many consumer products. So even if you haven't heard the letters PFAS before, you've certainly heard of products that contain them. So one example are carpets and upholstery. If you think of things like Stainmaster or Scotchgard, waterproof apparel with Gore-Tex, certain types of floor waxes and ski waxes, nonstick cookware with Teflon and other Teflon-containing products, certain grease-proof food packaging, for instance, microwave popcorn bags. I already mentioned Oral B Glide dental floss, which is basically a thin strip of Teflon, which is why it's so nice and non-sticky in your teeth.
Yeah.
And certain certain kinds of paints as well. And the newest one I learned about was guitar strings. So
What?
No. No.
I was just reading an obituary of Gore, who made Gore-Tex. And in the list of products they mentioned were certain types of guitar strings. So
Oh my God.
I'm always learning something
Who
new.
knew?
Yeah, I didn't know that one either.
Wow. Huh.
So what does PFAS stand for? I'll try to keep the chemistry light. I know it's after 5 o'clock, but it stands for per and polyfluoroalkyl substances. We used to call them PFCs, which was a little bit easier to say, but PFAS is a broader term that really covers this whole family of related chemicals. And they have some characteristics that make them particularly unique and challenging. So one is their extreme persistence. They've been called forever chemicals, and people have said that they basically persist on geological timescales because they just really don't break down in the environment. It's a complex family of chemicals. The OECD estimated over 4,700 PFAS chemicals in use. I've seen a more recent number from EPA. I think it puts the number at over 8,000. So they all share some unique characteristics, but there's just so many different variations on the chemistry.
Yeah.
And they're very versatile as well. In addition to being in consumer products, they're also found in, they're also used in metal plating. They're used in certain firefighting foams, as we'll talk more about, for instance, at Fort Devens. And yeah, just in a lot of other industrial applications as well. for those of you who like to visualize things a little bit, and I try not to geek out too much on the chemistry, but if you don't learn any other PFAS chemicals, you do have to know these two. So this is PFOS and PFOA. These are the two that show up most frequently in the environment and in people. And if you've watched the film Dark Waters or The Devil We Know, they talk about C8. So C8 is the same as PFOA. And both of them have this characteristic. So this blue zigzag here in the middle. I don't know if you can see my mouse moving. Yep. These are all carbon atoms. So this has a carbon backbone with many fluorine atoms around them. And they have this head here that doesn't like to be in water, and then this part here that does like to be in water. So it means that they have like dual personality, where they like to be in water, but then also kind of tend not to, and that helps with their stain and water resistant properties. And then there are many variations. So these are what we call long chain, because it has this 8 carbon chain. Some of the alternatives to this have a shorter chain, so maybe just like 4 carbons instead. And sometimes they have oxygens inserted in here. So there's like different variations on that. And then just one last thing I wanted to point out is that if you kind of squint your eyes and look at these from a chemist's point of view, these also kind of look like surfactants. So these are used in firefighting foams. So they have this kind of surfactants are in soaps, and they also have these kind of dual properties of a water repellent and water soluble head. And then they also look like fatty acids. And this explains, or scientists think this explains some of the effects on metabolism of PFAS. So these are forever chemicals. So they have kind of a global cycle, just like we talk about the water cycle or the nitrogen cycle. These are all man-made chemicals, so they all start from a factory somewhere. They can end up in consumer products. They can end up in these firefighting foams for fuel fires called AFFF. They can be discharged into the environment through the waste infrastructure, or for instance, from atmospheric deposition. And then we can be exposed as people from our food, because the plants and the animals that we eat can absorb these from the environment. In some communities, water has been a really important source of exposure, as well as consumer products. People are particularly concerned about exposures to infants because of their sensitive developing bodies, and the potential for higher exposures during pregnancy. These can be passed from mothers to infants in the womb, as well as through breast milk.
Wow.
This chart, I actually probably need to download a new version of this, because this keeps getting updated by the Environmental Working Group. So this shows over 600 contaminated sites across the US where PFAS have been found. This kind of shows a mix of military sites, of places where these have been found in drinking water. And in some cases, let's see, Michigan and New Jersey have a lot of dots. That's because they've done a lot of testing with new methods. You know, if you look hard, you'll find them in a lot of places. So the places that don't have any dots, it doesn't necessarily mean they don't have any. They just may not be looking yet.
Yeah, okay. Okay. Yeah, because New Jersey I kind of expected, because they have a big chemical industry. Yeah. But I was looking at Michigan going, wow, what is going on in Michigan?
Well,
they do also have industry. So it's
yeah, they do. Yeah.
And, I mean, look at Flint, Michigan was the toxic.
Yeah, and I've heard that the river there also has PFAS as well. So and the Environmental Working Group has estimated that 110 million Americans may have PFAS in their drinking water.
Wow.
So not surprisingly, because PFAS are in so many consumer products and they're so stable, we all get exposed to them. So nationwide testing by the Centers for Disease Control and Prevention have found that basically all Americans have detectable PFAS in our bodies. And part of the reason why they show up so frequently in our bodies is that, in addition to the chemicals themselves being very persistent, some of the PFAS, especially the long chain ones like PFOS and PFOA, stick around in our bodies. So our bodies just have a hard time excreting them. So even after you cut off new exposures, they can stay in our bodies for years or even decades. The newer replacements, some of these shorter chain versions are the ones that have different variations of the chemistry. Industry likes to say, oh, well, these have a much shorter half-life in the body. But from what I've seen, the half-lives are still thought to be on the order of weeks, which is still kind of a long time for a chemical to stick around in our bodies. By contrast, when you take a medication, those get excreted on the order of hours, or even environmental chemicals like BPA, which we hear a lot about. That also can be excreted very quickly. So I wouldn't call it short half-life, maybe.
Yeah, shorter, maybe.
Shorter, yeah. So some PFAS are no longer being manufactured in the US or in Europe. So PFOS and PFOA are among those. And so you can see that reflected in blood levels. So PFOS and PFOA levels in the general population have gone down in recent years. Others seem to be more stable, and some seem to be increasing as they're used as replacement compounds.
Laura, I'm just going to add a quick comment, which I'm pretty sure I have correct, which is I think you said that one of the reasons why it stays in our blood so long is that it adheres to the protein in our blood, and we have a hard time breaking the bond. Our bodies have a hard time. Is that correct?
So they do. So they do tightly bind to proteins in our blood, and then just in our kidneys as well. They also get reabsorbed very efficiently.
Great, just what you want in your kidneys.
So unfortunately, PFAS have been linked with a wide range of health concerns. The evidence that we have is based on both toxicological studies, so studies in laboratory animals, as well as epidemiological studies, so studies in exposed human populations. Some of which is just the general US population, because again, everyone, regardless of your drinking water source, has been exposed to these.
Right.
So there's kind of varying levels of evidence for different types of health effects. I'd say that immunotoxicity is one of the strongest, has the strongest links with PFAS exposure. The National Toxicology Program conducted a systematic review in 2016, and they found that PFAS and PFOA were presumed to be immune hazards. There's also been an extensive series of studies by our colleague Philippe Grandjean from the Harvard School of Public Health. His work in the Faroe Islands suggests that children with higher PFAS levels have somewhat dampened responses to vaccines. People are concerned, scientists are concerned whether there might be links with COVID, either COVID susceptibility, or down the road when a vaccine is developed, will people in communities that have had high PFAS exposures, not be as helped and still continue to be more affected by COVID.
Right.
That's scary.
Yeah, not a good time for that.
Yeah.
Yeah. I mean, COVID's pretty new, so no one's, there's not really any direct studies of that yet, but I know a lot of research is trying to tackle that question right now. There are also effects on the metabolism, things like elevated cholesterol, where there seems to be pretty consistent evidence across many different studies. There's evidence for PFAS exposures being linked to thyroid disease, certain types of cancer, and in laboratory studies, altered mammary gland development. And that's one thing that we pay attention to. A lot of our work focuses on breast cancer, and we think that chemicals that can alter mammary gland development in animals might in some way increase breast cancer risk in women. So kind of big picture, where are we at in terms of our knowledge about PFAS health effects? So a lot of the research that's been done is focused on really just a handful of PFAS. So PFOS and PFOA have gotten a lot of attention. A couple of the other long chain PFAS have also been studied quite a bit. But a lot of the other ones really have very little information about, particularly in human studies. These newer replacement chemicals that are being touted as, safe replacements for the really bad ones that we're no longer making. There's growing evidence that they can be associated with some of the same health effects. Typically, they seem to occur at higher levels of exposure, so they seem to be not quite as potent as the longer chain compounds. But even that seems to be shifting a bit. This picture here is from an article last month about one of these shorter chain replacement compounds that the Food and Drug Administration had previously allowed to be in food packaging. Their own scientists had done work and found that actually this one seemed to be more persistent and more toxic than previously thought. And so they're working to phase that out of food packaging now. So I think the conventional wisdom that the short chain ones are, safer or stay in our bodies less, like those are all kind of being called into question.
Yeah.
And then, with any, environmental hazard, there's sort of varying levels of evidence for different health effects. So the immune effects, for instance, have pretty strong evidence, and we see agreement between the studies in people and the studies in lab animals. And then others have less consistent evidence. Some studies show an effect in these populations, and then other studies maybe don't show that effect. Again, that doesn't mean there isn't one. It just makes it harder to figure out, which are the health concerns of greatest concern, and at what levels those might happen at. So there's a lot that we're still learning. What are the levels of exposure associated with health effects? Does the timing of exposure matter? If you get exposed early in life or in the womb, can those create long-lasting effects? There's a lot that we don't know about the health effects of the newer replacement compounds. And then a whole new can of worms is, how do we deal with mixtures? So when we study exposures to firefighting foams, we measure PFOS, PFOA, those are the ones that stick around in our bodies, but we know there's a mix of many different PFAS chemicals. We don't even know what they all are, but what's the effect of that mixture, and how does it different than when we study each one, just one at a time? And what are these exposures that we're missing, both in terms of individual chemicals we might not know about, and as well as other exposure pathways, like guitar strings.
Dental floss. I'm still astonished by that.
So here's some fact sheets. If you want to learn more about PFAS, this is for an online resource center that we've developed for a different research study.
Nice.
PFAS exchange. We also have information about different groups in states. So if you're just learning about contamination, you can click on your state and learn more about what your state is doing, what community groups are addressing these challenges. We launched an initial version of a data interpretation tool, so you can type in levels for your blood or water and receive some information to help you interpret what those mean. So you can check out that website, pfasexchange.org. So to learn more, you can visit our website or contact me. This is the PACE Facebook page. And you all know how to find Lori.
We do.
Yeah. And the DPW has information on their website as well. They've done a great job with tackling this issue.
This is a great point to bring up. I'd like to, this is some great information that you're giving us, and I would like to put this in a repository where people can access it. But I'm wondering, should we, kind of set up this PFAS, area of the Board of Health website, or would it be more efficient if we just did, PFAS to learn more and then link to PACE or someone else? It's like, I don't want to duplicate the documents that are out there. Do you have any thoughts, Laurie, on what would maybe be the best way to?
Yeah, and then there's also DPW resources.
Right.
It would be a matter of who can keep updated the best. And
With that.
Yeah. It might be good to talk to Mark Wetzel and see what his thoughts are, because there could be a clear delineation between Board of Health being in charge of more like the health effects, but maybe DPW having the facts about what the results are from the testing that they've done and the status of the filtration plant.
That's a really good point. I do need to talk to Mac, especially when I read the article too, that the new limits have come out. All right, I will talk to him and find that out. Now, the information that you presented here, is this a PowerPoint? Yeah. Okay. Could you send a copy of that to Heather so that we can make sure that at least get linked to, it's information that was discussed at this meeting.
Mm-hmm.
And then if we do decide the Board of Health is going to try to keep some kind of repository, we can, maybe also put copies there.
Sure.
Cindy, do you have any thoughts on this?
Yes, Pam. So we can, what we like to do is have topic subject pages on our website, and the DPW has taken the lead on putting all the PFAS information on one page. But we could certainly create a health area on that page and cross check them to the Board of Health page. Where you would click on the PFAS information, and then we would have just one page where everything lives, rather than having all these little islands of information where people have to hunt around for things.
Exactly. That's
that'd be great.
Yeah. That's
and then the only comment I'd have on that is too, that DPW sends out comments and like water bills and stuff, or whatever updates have been going on, and I'll sometimes get the phone calls on that, but I never sent the information. It was actually came from DPW, so it's probably best if it stays in just one place. And DPW becomes a point for that, because any information as far as wells being taken offline or water restrictions, that's all handled through DPW. It's nothing to do with the Board of Health.
Right.
Okay.
And I don't want to create any confusion on that.
Gosh, we don't need that.
Yeah, that's a very good point.
What we really try to do is just have a targeted, focus for people who are looking for information and having everything on the same. That seems to work out pretty well. So I can help.
I'm just going to insert, I wonder if that might need to evolve or change, because the big study we'll be doing is a health study.
Right.
Falls more under, clearly, to me at least, under Board of Health.
Mm-hmm.
Mark is helping us get the data that we need, but it is a health issue.
Yeah,
that's kind of what I was thinking. Yeah, maybe we put the Silent Spring project information, maybe that is primary Board of Health or something.
Yeah.
Because ongoing,
we start at the same place.
Yeah, and when that really gets going on, when Laurel has, from what I understand, you're going to be coming to Ayer, have an office in Ayer, and then take the data and the research. So that's definitely something that would fall under us for questions or connections or whatever, and shared information.
Yep.
Absolutely. Right.
Okay, so whatever you need me to take care of for you.
Okay. Well, Laurel and Lori, thank you so much. That was a great refresher as we're going through this. I'm remembering hearing, oh yeah, we talked about this when we, did the meeting at the school, but it never really hurts to have a refresher. And I like the really kind of nice, concise, kind of basic information that you put together in this presentation. So let's keep it, Heather, with the meetings minutes or packet or whatever that we put up, because it was information we discussed here, but I think I'd like to also have it someplace that you don't have to dig through meeting stuff to find it.
Yeah, we'll put the presentation from tonight somewhere on the Board of Health site, or we can send you feedback about that tomorrow. I'll getting that on there once I get it.
Heather and I can coordinate that.
Yeah, that's fine. And does that sound like a good kind of, not, we don't have to decide this right now, but does it seem like if we kind of split along those lines that maybe, and I'll talk to Mark about this as well, but perhaps the DPW information on the actual testing, test results, levels, data, it's good to keep that probably on DPW, because if I had a question about water quality, I would first look at DPW. And then perhaps the project with Silent Spring, we could have at the Board of Health kind of primary link or something.
Yeah. We'll make it work the way that it is. I mean, the way I try to look at our website is though I am someone looking for information.
Yeah.
And I'm just looking for information on PFAS. I don't want to click on 15 things.
Right.
I like one page with a lot of stuff on it, but we can certainly put that page in both locations. So whatever makes it work.
You're the IT wizard, Cindy. I know you're going to make this work. So thank you. Thank you very much, ladies.
Just to close out that, I started hearing about PFAS quite some time ago, and it did take me several meetings like this and several sessions to really appreciate the depth of the problem. And little things coming out, we're learning new things all the time about it. And I honestly didn't realize how serious a problem it was until maybe a year and a half into first hearing about it. So the slide that Laurel showed that showed like the cycle of PFAS circulating around, and we go, oh cow, we got to get rid of this stuff because it's water cycle. About elementary school, once it's there, it's there.
Right.
We have a lot of it from Fort Devens, and we have to address it.
Yeah. Pam?
Yeah.
It's Bridget. Since we're on this topic, I just had a quick question. And I think maybe this might be the right time to slide it in. So with the current weather situation, we have actually had an unprecedented amount of requests for private drinking water wells for people that are actually on town water because they can't irrigate their lawn. So I have basically told everybody if they wish to put in an irrigation system, they do have to test for PFAS. And then if they do have it, would obviously treat it. And I consulted with Mark Wetzel on that, but maybe at some point we might want to look at our well regulations to actually specifically incorporate some of the stuff for PFAS. Just a thought.
No, that's a really, really good point. Are these mostly people wanting to use it not for drinking? Is it it's irrigation, or are you getting some drinking water wells too?
So it's for irrigation, but we don't have any, once they put in that irrigation well, there's nothing stopping them from using it for drinking water. Right. Obviously it's cheaper. So, because it's a private well. So it's just something to think about, but we had so many requests this summer that
So Laurie and Laurel, what Bridget's mentioning is that there's a Board of Health regulation for private wells.
That's really,
and perhaps we could work with you to. I think Bridget makes a great point that we should, if we're getting a lot more requests and we know PFAS and is going on, we probably should look at that well regulation, and perhaps you two could help us come up with the right wording, or how to properly address that.
So we can also consult with DEP. What I usually do is contact DEP to find out if they already might have the wording, and then maybe have them review it with the with the board.
Oh, right.
That'd be good.
But like I said, we've had that unprecedented amount of requests, and most of Ayer is on town water. So it's just something to think about. And like I said, we have told everybody, if you do want to put the drinking water, the irrigation well in, you will have to test for PFAS.
And that really concerns me. My it seems unstable, but that concerns me a lot, because depending on where you are in town, you might not find PFAS the day you test it, but that doesn't mean you're stuck it in later.
Exactly, and that's what we tell people, because it's just that quick snapshot, and it's just like arsenic. You can have it, and the levels can fluctuate, and they can go up and they can go down. But it's sort of like once the well's in, it's up to the homeowner after that to monitor it, and who's going to do that?
Yeah, how does that happen?
Yeah. Well, how is the regulation on the limits written? Does it address, is it broad enough to include well water, or does it specifically say public water supply? Are we all here and live? That was a weird little glitch.
Lori's frozen. Oh, where'd she go?
I'm here. I don't know.
Was that a question for you, Bridget, or for Lori and Laurel? Pam.
Really for anybody who knows.
So I think it incorporates the private wells as well. I do know that some of the other towns that we do cover, they're dealing with this because they mostly have private wells, unlike Ayer, who
Right.
has a lot of public water. So I think Stow's one of them that they're dealing with it in private wells,
Okay.
because of the fire.
Yeah.
There's that
Fire
training
Academy.
facility.
Yeah.
Yeah.
So, but I just, I at this point, like I said, I just thought it might be good to kind of look at that for the well regulations because,
Yep. No,
you never know.
That's a great point. So let's take that on. We, Board of Health, can take a look at our regulation, maybe what information is out there from DEP. If we decide that we want to, make a revision to our regulation, we certainly would run that by Laurel and Laurie and kind of just get your, at least your blessing on it, that
Great.
it seems appropriate to you. So.
Can you hear me okay?
Yeah.
Yeah.
Okay.
Yep.
My internet is not stable. I'm going to bring up one other can of worms, and we may want to table this for further discussion, but I feel compelled to say something, which is I heard from a citizen in Ayer just this week about the playing field that's being reconstructed at the high school for sports, that they may be using artificial turf. And Laurel, you can verify this if you know more about it, but artificial turf is also under suspicion of being loaded with PFAS. In part because it helps to create it, and in part because it helps to release it from the forms that they make this stuff from. And so I certainly have a lot of concern if that's the intent. And I'm not in that loop at all. I don't know how to even get in there, but it was brought to my attention just this week.
Wow, that's interesting.
I don't know if you have any jurisdiction in anything like that.
Well,
I think
maybe
unless
Bridget-
there's a regulation or, like some kind of state limit or advisory or something, I'm not sure that we do, but what do you think, Bridget?
So I'm just thinking out loud. I guess the first thing I would do would be, would the school committee know what is going on as far as the renovations of the track, and would they have that information?
I think Bill Plunkett is the business manager and in charge of grounds, and he oversees a lot of that stuff. He's a neighbor of mine. I think Bill would know because he would have to be in charge of the bids for any of the products that they would be using in and out of the school. So I think that Bill Plunkett would probably be the person to talk to, because he would probably have a more in-depth idea of what exactly it's made out of.
Okay, gotcha.
I just shared a link in the chat.
I see.
Yeah.
This is the Toxic Use Release Reduction Institute at UMass Lowell. They have a fact sheet. I just kind of quickly was looking at that, which could provide some more information. I don't know that a ton is known about it, but there has been some testing to show PFAS in artificial turf for just the reasons Lori mentioned, like the extrusion.
So who would call and check on that? Is it do we as a board reach out to them and ask, or Lori because you're on PACE, or Bridget, is it something that would be an Ashoba Board of Health question? I'm not sure who would take the lead in asking for that information.
I'd be willing to place the first call and then report back to you next week when we see you next week. Let you know if I have any progress, and then if we need, you have more authority than I do.
Well, no, I just wondered about the, like you said, Pam, the jurisdiction, but PACE is, it's a different entity on it. You have more access to people
Yeah.
than we do at some points. Yeah.
Yeah, there's advantages and disadvantages. I
Yes.
think, either one.
Yeah, exactly. Well, that would be fantastic, Laurie, if you're willing to make the initial inquiry, find out what's going on, and then on our end, we can do some thinking about, do we want to make a recommendation, to the school committee? Do we, does this rise to the level of something that we feel like we need a regulation for? But you're right, Laurie, it's a can of worms.
Also,
we're going to temporarily put the worms back in the can.
Is it already happening, Laurie? Do you know, or is it something that they're bidding on, or?
I don't know where the process is. I don't know.
Okay.
What I know, I think, is what we all know, which is they didn't get the amount of money that they wanted to do the full thing.
Mm-hmm.
I don't know where we are. And then COVID and, all the things that have.
Yeah, I know.
I can find out.
Okay.
All right, that sounds good. Let's take it one step at a time. What you find out and report next week, we can go from there.
Okay. Thank you.
Okay.
Yes, thank you, ladies, very, very much. We love seeing you. We appreciate it. We hope to have a nice collaboration here going forward. Yeah. So I will keep you on the agenda for the next meeting to do kind of the next phase of this. And because we still have to do regular Board of Health stuff. So I think if we do this in some nice kind of small pieces on a regular basis,
that's better for us.
Yeah, and I think
it's in a good place.
It's easier to digest because I know I went to a couple of those meetings at the school, Laurie, and slide after slide after slide, right over my head, and the RAB meetings also.
Yeah, I was going to say it's like a RAB meeting.
Yeah, but given just the few slides there that you can digest it and you can kind of relate to it. It was easy to understand, and I thank you, Laurel, for putting that up. Yeah.
Great. Thanks. Yeah, this is a great way to we have plenty of time to talk about it, and sort of, there's a lot of aspects to it. So this worked well. And one of the few upsides of COVID is I can do this from my attic. So it's easy to come.
We're all in our attics or somewhere.
Yeah. It's all good.
Okay, great.
So we'll be back next week.
Next installment will be October 5th.
All right. Yeah. So we'll talk, next time we'll talk more about drinking water specifically, kind of what's happening.
Yeah. Yeah, that sounds good.
Level and the state level, and we can talk a little more about the study specifically. Okay. Sounds good.
Yeah. And hopefully as we get going on this, maybe if people watch this at home, they'll have some questions, and we will actually have, things. People will have questions that they send to us, and we can ask you for the next time that they're getting something out of this and they're interested and they're able to talk about it. So
and the idea of doing like a public forum for information is very much still on the table too. Right. And maybe that, like you say, Trish, if rather than present a lot of information at the forum, maybe we even think about ways to do that forum so that it's in various pieces. So that if you just want to learn about the background and what substances it's in, that's one thing. If you want to specifically talk about air and the drinking water, they're not really independent topics, but and then there's the study with Silent Spring. So we have a lot of flexibility for how we handle this. Right. And Board of Health definitely wants to work closely with you on supporting this. It's important to us too.
Really appreciate that.
Thank you.
Well, thank both of you. Thank you, Laura.
So
you're a warrior for this town. You
are.
Always have been.
We're keep going on this.
Absolutely.
A little bit longer. I think Laurel's going to go. I want to hear a little bit about the COVID stuff.
Yeah, I'm gonna go see what my kids were needing before. Honestly, they left me alone all afternoon, and of course, it's the second I'm about to actually.
Oh, good. Well, you're
Move
certainly
here.
welcome to stay on, either of you or not. It's up to you.
I will.
But we'll definitely have you
off.
on. We'll have you on the
Okay.
agenda for next week.
Thank you, Laurel.
Thank you so much.
Yes,
Nice to
thank
see
you
you all
so
again. Bye.
Thanks.
Thanks.
Bye.
So we're kind of taking everything out of order on the agenda, but I don't think that's a problem.
No.
I guess if it is, it'll be too late by the time I figure out that it is. So, Bridget, what's going on in the world of COVID and coronavirus and all that good stuff?
Well, I think so far, everything so far so good, knock on wood. Ayer specifically is in a very good position. And the governor made some changes last week that became effective today regarding restaurants, specifically with the use of bars for dining, not for drinking, but for dining purposes. And they need, the plexiglass just around the bar area if they can't keep 6 feet from the customers, the bartender. So with that said, we're anticipating the next couple of weeks just, an uptick in questions from restaurants about that. And then, maybe residents concerned because when they walk in, they'll see some changes. So that did go into effect, like I said, today. So I think
feel like
yeah.
You get everything set, with one, set of guidance or regulations, and then it seems like it's changing faster than I can keep
Just when
up.
you memorize it, it changes.
Yeah, that's what I mean.
So, and what we really try to stress to people is that all the information is on mass.gov. It can be difficult to navigate, but it is all there. And when I say difficult, it can be overwhelming because people think that something you go one place and you have to do something because you see it in a restaurant or whatnot. And we're constantly telling people, for example, there's no glove order. Restaurants, you see some things because they're putting things in place in the restaurant, but overall outside of the restaurants there is no glove order.
Gotcha.
There is the mask order. So we're just constantly explaining to people that you don't necessarily need to be wearing gloves. Some people just do that for their own purposes, but it is literally, it changes. It feels like it. So, but we are moving into flu season too. So we're getting ready for the flu clinics, and all that information is on our nursing Facebook page. So if people do want to go get flu shots, they don't have to specifically go to Ayer. They can go to our other 17 communities if there's something, a better time for them. So.
Yeah.
And how does that work, Bridget? Is it insurance or is it free, or how do you go about when you go to the clinic?
So they go through the clinic goes through insurance, our clinics, and then there are free clinics at the some of the bigger box stores, and then like Walmart, I think I've seen them, CVS, Walgreens, like the pharmacies will have free flu shots.
Yeah.
And I think I've seen some of the 24-hour urgent cares might do them, but I could be losing my mind on that. I'm not sure. But and obviously pediatricians for children and your regular healthcare provider can get those for you as well.
Yeah. And our flu clinic, we should mention again in Ayer, is on October 19th? Is that right? Okay.
Yeah.
Yes.
Lori?
I'm
sorry.
No, I'm sorry. Just before I forget, I want to mention to Heather that was October 19th is one of our meeting dates. So if you could post a cancellation notice for that October 19th meeting,
Okay.
because Trish and I are both working the flu clinic,
Okay.
different time slots, but on that day. And then if we have to have a second meeting in October, we'll figure out a day when we can do it.
Right, very good. I'll do that.
Okay, excellent. Because I will forget for sure. Bridget, if you keep getting a lot of like the same questions about gloves, or we could think about doing like a frequently asked questions thing, and either putting it on the Showbiz website, or putting it on the Board of Health one for Ayer.
Cindy, are you there? Is my friend Cindy there? So she's been posting some stuff on the Ayer page,
Okay.
and then we've been trying to post it on our Facebook, the Neshoba Nursing Service and Environmental Facebook page as well. Just so that it's the basic stuff about wearing a mask when you need to wear it. And then
I'm thinking more. I'm sorry, Bridget. I'm thinking more of these situations where, like, I know you've mentioned to me before that you get calls that people are working in food establishments and they're not wearing gloves, and so I'm thinking kind of more of clarification of things like that.
Yeah, frequently.
Yeah,
we have a tool for that. To put right on your.
Okay, there's already a section for that.
I have an easy tool. Just send me the question and the answer, and I can just create that for you in minutes.
Okay.
Thank you.
Okay. Thank you, Cindy.
You're welcome, Bridget.
Lori had a question in the chat.
Yeah, I did not see it. How do I get it back?
Can you hear me? I can say it.
Yeah.
I was wondering if the flu shot is the same if you get it in Walmart or get it at your doctor's office. So I thought going to your doctor's office had some advantages, that it was a higher quality or more current or less preservative.
So we get. I've only been in the office when the flu shots arrive, but I think it's pretty standard from the Department of Public Health. I think all comes from the same place. If that's what I heard from our nursing staff.
I think I think that you're right, Bridget, that it is essentially all the same stuff. The only difference that I'm aware of, and this might not be a big deal this year, but I know in years past, there's been trivalent and quadrivalent. So they either, mix in like the 3 most likely strains that they think are going to come our way, or the 4 most likely. So that you could ask, am I getting the vaccine that is based on 3 or 4? And
and I can ask Tamara that. She's the town nurse. I can ask her that tomorrow. Because I know she did say it changes depending on what they expect during the flu season. So
Right, and there's also 2 different, I'm pretty sure, Lori, there was a nasal spray that I've seen, and there's also injectable. And I know at one time there was people that had immunosuppressed, people that had those different issues. They cautioned them about a live vaccine. So there was some controversy about getting the live vaccine versus whatever else they make, and how many strains they shake it up and put it all together or whatever. But those were some questions that I had heard from other people too. Is it a live vaccine? Is it injectable? And I don't know if it was the kids that were getting the little nasal.
Oh yeah, I wonder.
Yeah, we'd have to ask Tamara.
Yeah, exactly. I'm not sure. Yeah, it would actually be, I mean, really, I guess the baseline is that I would say you're better off with any kind of a flu shot than you are with no flu shot.
Yeah.
So I personally, I only happen to recall the, trivalent, quadrivalent. So when I went to my doctor this year, I asked, what is this? And they said, oh, this is the one that has 4 strains in it. So, but there may not even be a trivalent version this year, because the flu vaccine, as we all know, it's truly different every single year, because it's based on what strains they think are coming our way.
Right.
So, yeah, I would say get anything. Another thing that's worth looking into, and maybe this is something that maybe we need a flu shot FAQs if we don't already have one. But I've been seeing some information that says flu shots, they last like 3 to 4 months. You get really good protection, and then it starts to tail off. So I was reading something recently that said if you want to make sure that your flu shot covers you further into the flu season, you might want to wait until October or November to get it. Versus, I got mine back in September. The minute the doctor got it in, I do it. And now I'm kind of thinking, oh, geez, am I going to be thinking about doing it again in January? I don't even know if you can have 2 flu shots in a year.
Yeah, good question.
Yeah. So.
Well, Pam, I'm going to be studying about the flu this evening.
Oh, geez. I know. I'm sorry. We keep giving you these crazy new.
Well, you ask these questions, and then I have this burning desire to know what the heck the answers are.
I know. I know.
No, but and I'll check with Tamara too,
Okay.
because I know it does get confusing, but I do also know that, just sort of as a side note, the Department of Public Health, and I think you can navigate there through mass.gov. They also have they have fact sheets up there. And I'm in the middle of relicensing all the food establishments. So my goal was to actually update some of the stuff on the Neshoba webpage for the flu season,
Sure.
but I got sidetracked. So I'm going to make a point tomorrow to maybe get some of that stuff posted and just do facts on that as well. But I do know that mass.gov does have some of that stuff under the public health webpage.
Okay.
So
I got
if anybody wants it, but so far, back to the COVID, so far everything, with schools seems to be okay. Nothing major, I don't think, again, knock on wood. And we basically, every chance we get, we try to tell people the best thing that you can do is limit your contact outside. The less places you go, the less risk there is. And so keeping that in mind, whatever people do outside of school or outside of their work, they can bring that into that work environment or that school environment. And, people say, what is the incubation period? The average incubation period for COVID from we're seeing is about 3 days. It can be, as much as 2 weeks before the onset of symptoms, but the average is roughly around 3 days. And I think we're still in that age bracket of 12 to 22-year-olds that are.
Mm-hmm. So it's that soon. It's like a couple of days after you're exposed to someone who has it.
It can be up to 14 days, but the average is somewhere between, I think, 2 and 5 days, and I think around the 3rd day is when most people. Again, it can change. It's just the average.
Okay.
So keeping that in mind.
Initial symptoms, anything different? I know that has kind of changed a little over time.
With kids, it tends to be more the runny nose, sore throat type of thing. And then with adults, I think the cough is still the fever, that's still there. But I think with kids, again, it's just from what, again, specific to this area and talking to our nurses, is the runny nose, the sore throat, and the kids recover quicker than their parents and grandparents.
Right. Yeah.
So.
Great. Not going away anytime soon.
Yeah.
I'm afraid.
You know, yeah, I mean, again, it's the best thing that people can do is just really be diligent, and really limit large parties, being in places where you're not wearing a mask. The close contact is the key. We really try to stress to 6 feet, 15 minutes. That's what a close contact is. So if you walk by somebody in a supermarket, that's not a close contact. So the checkout person at the supermarket, that's not a close contact because it's not, it's like I said, closer than 6 feet, for more than 15 minutes.
Okay.
So I guess that maybe a positive way to look at it is if the mitigation that people adhere to for COVID could also make it a weaker or a less of a problem with the flu. I mean,
flu season.
That's the same thing that you're going to do for COVID, the mask and the 6 feet, and hopefully the flu season will be less intense. I don't know if that's just positive.
Absolutely.
Yeah.
That's what I kind of, I think I had even mentioned that to you, Pam, that it might make the flu season, less severe than what we think. But, people ask me all the time, do masks make a difference? And I have to say, yes. What we're seeing is more related to close contact with people. If in one of the trends right now is if a child or a kid goes to college and gets sick, for example, they come back home to recover, and when they come back home to recover, their entire family gets it, and that's because the close contact. No one's wearing masks. Obviously, you're in the same circle in the same house, so it is very contagious. So keeping that in mind, it's just really important to understand that despite what people think, we are really seeing that masks do make a difference, especially when you're out and about. So,
agreed. Yep. And I think what makes it a little more difficult right now too is that it seems like, oh my God, we've been doing this for months and months and months, and the numbers in Massachusetts are so low, so we can start to let our guard down, and that's just so not true.
Well, we have to keep in mind is yesterday we hit almost 600, so the numbers are going in the wrong direction again, and it's because and again it's I say this, no one really likes wearing a mask, but at the end of the day, it's a simple thing to do to keep, people safe around you and to keep yourself safe. And the more people that wear them, the more you're protecting yourself and others as well. So with that said, it's just, it is a nuisance, and I haven't met one person yet that says, oh my gosh, this is a great thing to do. I love wearing my mask, but at the end of the day, it's like, when you go into surgery, your doctor's wearing a mask. Would you feel comfortable with him not wearing it? Your dental hygienist always has a mask when you get your teeth cleaned. Do you want them not wearing it? It's just really trying to get through the next 6 or 12 months, and people, it will eventually end. I mean, it has. I would like to believe it has to, but we just we want the numbers to go in the right direction, not in the wrong direction. So hopefully, with some due diligence and paying attention, you can stop that, because we all want to get back to normal, especially in the schools. But
I just want to get the point out there that now is not the time to think that we've won this battle or that we can relax a little bit, because a lot going on. There's kids coming back to school, and kids that went to school and say colleges, and then ended up coming back home because of things at school. So we've got a lot of population is moving around a lot right now, like it always does for back to school time.
Right. So
okay. anything, I know COVID has kept you pretty darn busy. Anything else from Neshoba that we should be thinking about?
So just the relicensing for the food has started. So those
Okay.
permits are going to start coming in the envelope. Other than that, it's just, we do have that, I can't even think of the name of the motel, but we have to set up the public
Casamana.
hearing.
Yeah.
Casamana, yep. So we should set a public hearing date for that, and it's a formality for the Mass General Law because of a new owner. So he has stated that it's going to remain the same, a hotel/motel, but and once we have that date set, we can notify him when the public hearing is.
Okay. Has he submitted a license application to you yet?
Yes. Yep. Yes.
Okay.
Yes.
All right. So that piece of it is done.
I think the license application, I think the name of the business, if I remember correctly, is Mimi's Place LLC. But it has been submitted. We just had that Mass General Law that we were looking at, and I did send that to him. And so we kind of, it's like I said, it's just a formality.
What's the name of it, Bridget? It's not going to be Casamana, or it's going to be a different name?
I think the name of the business might stay the same, but it's on the application, it says Mimi's Place LLC. So I don't know if he's going to change the full name and get rid of Casamana altogether.
Yeah. Okay.
Okay.
So according to the Mass law or regulation that we were looking at, it only has to be posted once. This isn't like a 2-week public notice. It's only 1 week that it needs to appear in the news. So I'm looking at dates. Heather, how long do you think, given, what's going on with timing at the newspaper and so forth, when do you have to get the notice to them in order for them to run it in the paper that comes out Friday?
So before everything happened, the deadline was always Wednesday at noon. Because they're all working from home now, the sooner I can get them to it, the better, because sometimes they don't always check their emails or whatever in time. If I send it to them tomorrow to get it in the paper for Friday, I can try for that, and then that would give us a week and a half notice. And then it depends on what the law states, if it just needs to be a public hearing, if there has a time frame, because then if they ask, because sometimes they'll just run it and say, oh, we didn't make it this meeting, it'll be in next Friday. And it's like, oh, okay, that's
right.
So it all depends on what that hearing is. If it doesn't have to be the 2 weeks, I'm assuming it's not a 14-day notice. So if I can get everything together, I can probably get it in the paper if I get it first thing tomorrow. Hopefully I can get it out if you want to do that on the 5th.
Do you want to wait until or try to have another meeting just specifically for this at the end of October, just so that we have enough time? And
that's kind of what I'm thinking, is maybe if we did it, say the 26th, move our meeting cancel the meeting from the 19th, but we could just do.
Do you have town meeting? I think on the 26th.
Town meeting?
Yeah, I think that's on the 26th, isn't it?
You might be right. I knew there was a reason why, because Columbus Day is the 12th.
Yeah.
That meeting is the 26th.
It is?
Yes.
Could you do another day that week?
I can. It's kind of a matter of like, when can we get Cindy? Are there certain days or times that are kind of open slots, or
coordinate it with Carly? She's the keeper of the schedule for all of that.
Okay.
So if you get in early enough, you probably shouldn't have a problem. You won't have a problem getting, whatever is for you.
Okay. Because the other thing I'm thinking too, Bridget, is we, need to make sure, of course, that date is going to work, I guess, for the owner.
So how about this? I can call him tomorrow and find out what works for him, and then maybe set it with a goal for the end of October. That way we have enough time to publish it. We do everything right, and it gives him time to prepare.
Yeah, I mean, worst case, I guess, would be the next scheduled Board of Health meeting is November 9th. I don't know if you think that's kind of going too far out, but we could do it that day.
I mean, I don't think it is. Like I said, this is just sort of a formality because of the change of ownership.
Right.
So, if I don't think that it would be a problem if you wanted to do that, if you're comfortable with it.
Yeah. What do you think, Trish? Do you think that...
I'm fine at this time of day. I have no problem, but like you said, it depends on the the owner, and if Carly says that we can schedule other than Mondays.
Okay. All right.
Yeah.
So you're kind of available. Now, we can't have anything on the 12th, right? Because that's a state or federal holiday, or no?
Veterans Day, right?
Yeah, no, you can't have anything on a holiday when the town hall is closed.
Right.
Yeah, so October 12th is Columbus Day, and town hall is closed on that day?
Town hall's closed. I think typically, though, Wednesdays, there aren't too many meetings, I don't think, if my memory serves me right.
Okay.
So that might be a day to shoot for the week if it works, because I don't think there's many meetings on Wednesdays.
That wouldn't be bad, because if we shoot for Wednesday the 28th, it does gives us plenty of time to get it in the newspaper. You know, if that works for everyone, and you want to ask him to do the 28th.
All right, so I'll ask him for the 28th, and then I will get back to you, Heather, tomorrow, and Pam, or I'll send a mass email to Trish. We can just confirm that.
Yeah.
Yeah, that sounds
okay.
Good. And then we'll do what needs to be done to get I was going to say get the room, but.
Yeah, I just looked at the calendar real quick. There's nothing on there right now. It's the end of the
Yeah, we can only have one meeting at a time by Zoom, so we can't overlap either.
Yeah, right now there's nothing. So if we put it in now, we'd be good.
Okay. All right. Well, let us know, Bridget, as soon as you get a hold of them, and we'll get that date
okay.
on. So I'm going to pencil that in. 20. Okay. So,
and so that's all I had.
Okay.
Okay. We'll wait to hear back.
The only other thing that kind of you might have some overlap with, Bridget, is I have under this administrative matters this status check on Board of Health permits, and that was just I didn't want to talk about it at great length tonight, but I just wanted to make sure that we are where we're supposed to be with trash haulers and animals and whatever other permits we normally do. So is that something, Heather, that you could kind of take a look at and maybe report on at the next meeting?
Yeah, I can do that. I know, just so you guys know, I don't know if I mentioned the last meeting, the state sent out Mike Hay has sent a letter out saying that they're holding off on all barn inspections due to COVID. So that's not on hold, but I will double check and make sure I have all the chicken permits. I'm pretty sure I do. I think we're all caught up on those. Trash haulers were all set on, although I do see a new company that's out. So I have to get see if I can figure out who went away and who took that over.
Is it Tully?
No, I don't know. I've seen it at my ex-husband's house in Shirley. I know I've seen a couple of them in Ayer, and I gotta double check what the name of it is. And I know I don't have a permit for them, and I think it's one that just got taken over by somebody else. So I just gotta check that.
Yeah.
And then
I think it's called Waste. Do you have the one for Waste Not? He just opened up on Westford Road, didn't you?
Yeah, no, I have.
Okay, we've had them for a while.
Yeah.
Yeah, no, he's very good. He got his right. He got his right
okay.
away. So.
Okay.
Yeah, just kind of give us a you know, a
I can do that.
snapshot. Where are we? Is there anything that we need to chase down? Because I feel like where we, you know, missed some meetings over the summer, I'm just feeling like I'm not really sure if we're.
Yeah, no, I can give you a status
Get up.
update and give you all the numbers of everything and when we start doing them again. Okay?
All right, perfect. Do we have anything with mail, bills, any?
The only thing I had was the, and the accountant already took care of it, as you signing it is just a formality, was the third quarter bill for Neshoba, but that was already paid. Knowing that we're
Okay.
not really meeting in an in-person status, you just put the bill through, so just so you know that that was taken care of and paid. If you do
Okay.
want to sign the permit, if you do want to sign the invoice, Pam, I can send it to you to have in the file signed, but
If
that's
I
up
don't
to you.
need, if I don't
No,
have
she
to.
said you didn't need to, so I just want to let you know
Pam?
that's all I've had.
Yeah,
Are you okay with me I'm sorry, I don't mean to interrupt. There's like a lag on my phone. Are you okay with me hanging up or?
Yeah, I think that's it for you.
Okay.
Thank you very
I just
much.
have to take the dogs out. Sorry.
Okay,
I
thanks,
got
Bridget.
you. Thank you so much.
Thank you.
Okay. Bye-bye.
Bye.
Okay. No, so if I don't need to sign it, then
No, you don't need to.
I'm not gonna bother. What did we, I couldn't remember afterwards what we decided we were going to do to get the minutes signed from last week, and then what we're going to roll
Yeah.
from that point into reviewing the minutes from September 4th.
You said the last meeting that you were going to sign them and then bring them over to Trish, and then they were going to drop them off, and I never saw them.
Oh,
So
Yeah, that's kind of
if
what
you
I
need me,
thought.
if you need me to resend them so you can sign them both, that's fine. Or I know at the meeting we had back in June, you guys voted to have just Pam sign them. So it's up to the two of you what you'd like to do.
I've got them, and I kind of thought that's what we decided. So
Okay.
I'll do that then with the minutes from last time, and I'll also do it with the minutes from this meeting. So there'll be two signed sets.
Very good.
So on that cheerful note, let's. Oh my gosh. It's like we just threw the whole deck of cards in the air and they scattered on this agenda. Minutes of the September 14th meeting, which you should have in your meeting packet. They look okay to me. Anybody have any comments, changes?
No.
Okay.
So Pam, are you going to get copies and then I can scoot over and are you going to initial for both of us?
No, what I'll do is I'll sign them, and then I'll either just stick it in the mail or like drop it.
I can come by and just an initial.
If I say here, right to my house.
Yeah.
Oh, okay.
I think what I'm asking is you have carte blanche, right? Or do I need to put a signature too?
I don't think I have carte blanche.
Okay, because
yeah, no, you guys kind of voted to allow Pam for you to just do that the last meeting in June with everything, but it's entirely up to you if you guys want to keep doing that or not. I mean, if the two of you can work it out, then you two of you work it out. It doesn't have to. It can go either way. You can have one person sign it, or you can have both of you sign them. It's fine.
I got it.
Yeah, you did vote in the June 6th meeting to have Pam have the authority to sign everything.
Okay.
Yeah, and I'm thinking that at least for these two, let's just do the usual. I'll sign them, and we'll get Trish to sign them. So we'll work that out somehow. Okay. And so, is anybody in the mood to make a motion on those meetings? Minutes?
I'll make a motion to accept the meetings of the minutes from the meeting for September 14th.
All right, I will second that. All in favor?
Aye.
Aye. Okay. All right. So we'll work out the signatures then on that.
Yeah, no worries.
And I think the last thing that we need to mention, I do have action items for October 5th here that we can touch on later, but so our third member, our clerk, Mary Spinner, has resigned from Board of Health for personal reasons. That was effective, I think either 23rd or 24th of September, her letter said, but it's not on the agenda. So it's not anything we're going to discuss. I'm just kind of mentioning it. I will put it on the agenda for the October 5th meeting so that we can discuss it and what the next steps would be. But so I think what I can do, Heather, is just cross out maybe Mary's signature line, or
No, it doesn't need to be, she doesn't need to sign it's the majority of the board. It doesn't,
yeah, that's true. That's true. Okay.
and then I'll just remove it for the next meeting minutes.
Okay. All right. Gotcha. So that will be on the agenda for the October 5th. Geez, in just a week, we have Pace and Silent Spring will be giving us another update. Anything else that Trish, you'd like to make sure that we get on that
No, I
agenda?
thought-
We'll do the permits.
Yeah.
We'll do a check on the permits.
But other than that, I thought most of that meeting was going to be reserved for them, for Laurel and Lori, to give us more. So it would be light. It would just be mostly them with the rest of that slide presentation, and
Yeah.
then the usual administrative matters, which are not very many.
Okay.
Yeah. What do you think, Pam?
No, I think that that's perfect because,
Okay.
We'll also have, I'll talk to Bridget before then, but, we'll also have a mention of the public hearing. We should know by then what
Yeah.
date that's going to be. So
Okay.
I think actually that's going to give us plenty to,
Yeah.
that's going to give us plenty to discuss.
Sure.
Okay.
Okay.
If you do come up with anything else, I'm going to work on the agenda tomorrow. I'll get it to you for sure on Wednesday or before.
Thank you.
Okay, Heather, and those will be the only things on it then for the next meeting. And then we just need to wait and see if Bridget can coordinate with the new Casamana owners.
Okay.
To get
All
our
right.
date. Great. Anything else for anyone? I'd like to, I don't think she's watching because I don't think she has access, but I would like to publicly thank Mary Spinner for her many, many years of serving on, I know she's been on many boards in town, but certainly Board of Health. She's been Board of Health for a long, long time, and I've learned a lot from her. She's a great repository of information. She remembers a lot of things. Yeah, memory like a steel trap. So
Yeah.
I will miss Mary's participation in the board, and I just want to thank her for. I learned a lot about Board of Health from Mary.
I second that, Pam.
Yeah.
Yeah.
Well, life goes on.
Okay.
What can we say? All right, then if that's it, I guess since it's only the two of us, Trish, geez, I'll make a motion that we adjourn.
I second that.
Okay, all in favor?
Bye.
Aye. All right, we're adjourned, 6:50.
All right.
Very good.